I'm speaking today with Bill English, William English. He's an assistant professor of strategy, economics, ethics, and public policy at the School of Business at Georgetown University. Bill has worked in and around our sector for a number of years now, researching several different areas of political economy and things that are related to the plasma industry. I guess is it fair to call you a political economist, or is there another type of modifier that you would prefer?
It's one of the better things I've been called. Yeah, that's great.
Okay, very good. So, Bill, one of the things that you had embarked with us on a few years ago was this discussion of the economic concept of crowding out. I want to talk about that. I want to talk about kind of regulatory policy and a heavily regulated industry such as we are. I want to talk about the importance of donor health, safeguards that the industry has put in place, and kind of the economic picture of what that might mean, and folded in through all of this because of the scrutiny that's been paid to this and some of the policy aspects of donor compensation itself. I think that you're uniquely qualified and situated to talk about some of these issues. But why don't we start with kind of what's most clearly, at least to me, in your wheelhouse, some of the studies and findings that you had with regard to crowding out that you did over the past few years.
Yeah, well, Dr. Penrod, it's a delight to be here with you and the PPTA. I think we've benefited greatly from your ability and the PPTA's ability to help us get data. And so many of these questions at the end of the day really are questions of data, they're questions of empirics. And the question that drew us into this, let's say, this industry and a larger debate, was this question of how plasma collections, how people walking through the door of a plasma center, giving blood, getting paid to do that, how that impacts this larger ecosystem of blood collections and blood supply in the United States, as well as other countries. And just to set the background, when we first came to this debate, this is sort of the late 2010s or so, two interesting things had gone on in the background. One is you had on the blood side a decrease overall in net on the total number of blood donations a few years in a row. And so you have this long-term decrease in people donating blood. At the same time, you had this exponential rise in plasma donations. And the question everyone was asking was, oh, is it plasma collections that are causing people to donate less? And you could see a possible story there. If you have a choice to get a needle in your arm, one place is going to pay you, one place is not. Well, maybe you'll go to the place that pays you and the other place is going to lose out. As we started looking into this, and people in the industry knew this much better than we did, we discovered there were a lot of other very complex factors in the background. And so one of them was an issue on the blood side of there simply being less demand for blood. We had gotten much better, particularly in surgeries, at using less blood in an open heart surgery or in arthroscopic surgery and that sort of thing. So there was this question on one side, was the decrease in blood just a decrease in demand, responding to the economics there? And on the other side, sort of, all these questions about who is donating to blood versus plasma, who are the plasma donors and what's the effect on them long term? Are they repeat donors? Or where are they coming from? Where are they going to? So what we did is we were able to look at this both in the United States as well as in Canada. And in Canada at this time, there had been a very lively policy debate, both within some provinces as well as at the national level. And it was about this question of would they permit plasma centers to operate and pay people to give plasma. And some provinces said no, some provinces said yes. There was a discussion of a national ban. And what we discovered first in Canada, and looking at the entry of paid plasma clinics, paid plasma centers, what does that do to the local blood collections? We have a very nice sort of difference, what's called differences in differences econometric setup there. And we sort of, to our surprise, didn't see any crowding out. That is, we didn't see a negative impact. We saw a slight positive impact, small but statistically significant. And in the United States, we had a data set that was much larger and in some cases, but both in time as well as geography, I think over 46 cities or so, that looked less at entry and more at growth. So as plasma centers collected more and more each year, what was happening to local blood donations? And there too, we saw the exact same phenomenon, that there was actually a small but significant increase. And so this raised a lot of interesting questions for us. I mean, it's interesting finding on its face. As we dug into the explanations on why, sort of the first thing that we discovered was it's really very different populations that are giving plasma versus giving blood. And so you wouldn't expect, if there's a big incentive to one population, yes, you get more of those people going through your door, but it's not necessarily impacting the other population. It's not disincentivizing them. And if anything, what we think explains the slight bump you see is what are sometimes called advertising spillover effects. So, there's a lot of advertising when a plasma center opens up. They try to, get the word out in the community. People see billboards, they see advertisements on the internet, and the marginal blood donor gets a reminder. Oh yeah, I can donate. Just the reminder you can donate, I think, is something that the margins is a small nudge. So that was the sort of econometric work that got me initially interested in this industry. But then as I sort of delved deeper, it's such a fascinating industry in so many respects. I think I've told a few people it's blood and plasma is the largest industry you've never heard of. It impacts our lives in so many ways. It has massive implications for healthcare, for quality of life, for saving lives. You also on the donor side have something like 50, 60 million donations per year. It's injecting a lot of money into local communities through people who are donating. So there's all these other questions that started popping up that has sort of kept us really engaged in this space. And we continue to do some, I should say it's my colleague, Peter Jaworski at Georgetown. We continue to do some both empirical work, both with plasma and blood companies to understand what motivates donors, how do people conceive of their donations. And we're also thinking broadly about policy questions that come up in this industry. So let me stop there because that was quite a mouthful. But yeah, our initial findings were surprisingly, it's different populations, so much less competitive than we thought, but still a lot of subsidiary questions for both of those groups of how do you get them to donate at the optimal levels for the most social welfare overall.
Sure. So let's zoom out just a little bit from that, because that was a great explanation of a lot of a tremendous amount of work that you've done over the past several years. But the U.S. Food and Drug Administration has articulated a number of factors which connote whether a donation is compensated or not, and there are a lot of different ways of looking at this. And there are many different methods that both blood banks and plasma centers have used over the years to encourage donation and to encourage repeat donation. And I was wondering, from an economist standpoint or an economic standpoint, what your view is of the difference between like a donor who, for example, donates to one of our member companies, plasma centers, and they get their fee paid to them on a bank card, as opposed to getting an Amazon gift card or, say, a lottery ticket, which is a little bit more of a difficult economic question, I guess. Chances to win, which have economic value, but they're not assured. Things like that. So what are some of the ways in which economists think that people approach these questions about incentives?
Yeah, it's interesting. 20 years ago, economists would have had a pretty narrow lens, and they would have said, look, if somebody is offered something, they're given an incentive, and economists probably would have thought of that incentive as whatever it goes for in a market. So whether it's a t-shirt, movie tickets, gift card, cash, it has some cash equivalent value. One of the, I think, most interesting developments in economics over the last 2 decades, though, has been in what's sometimes called behavioral economics. And the sort of interesting thing there is to branch out beyond economics to think about human psychology. And it turns out people do think about and treat different sort of incentives very differently. And that's where I think the complexity starts to come in, because as a regulator, they usually have the old school economist hat on. They say, oh, well, it's either compensated or not compensated. It's either an inducement, an incentive, or not. And that can be actually a very constrained theoretical apparatus. I'll give you an example of why in a second. What I think the tradition of behavioral economics says is you really have to look at how people behave in the world, and also think about what are the sort of cognitive frameworks they're bringing to it. So we had a visitor at Georgetown a few years ago who was discussing sort of blood and plasma donation in Germany. And this person said, oh, yeah, there's no compensation there. And one of my colleagues said, well, wait a minute, don't you get, and I forget what it is, I don't know, paid for the time off from work? They said, well, yeah, but that's not compensation. That's just giving you remuneration for what you lost. And, economists will say, well, yeah, of course that's compensation. But a lot of people, at least our visitors, said, well, no, that's just paying me for time that I gave up. It's giving me what's rightfully mine anyway. It's not a bonus, as it were. And I think in different cultural contexts, you get a very different reactions to that. The one way in which this sort of was really bizarre, and I think I shared this story with an audience of yours once, is back during COVID, at one point I was having a lot of post-COVID brain fog, and I got my test done, and it turns out I had sort of high iron levels. And there is a whole disease out there called hemochromatosis, where you have too much iron in your blood. And the solution for that, the therapeutic solution, is to give blood, because that gets rid of a bunch of red blood cells. Your body then is using the iron up. And to my surprise, there had actually been a history in the United States of not allowing hemochromatosis sufferers from giving blood in the normal sort of blood donation networks, because the argument was it was too much of an incentive for them to give. That is, they would be benefiting from it, and then they would be giving incentives to these people, and they wanted to keep it a totally altruistic arrangement. And that just struck me as totally bizarre, really, really unintended and wacky consequence of that framework for thinking about it. So right now, I do think it's sort of an interesting time in both the blood side and the plasma side, where I think both of those industries want to think about, what's best for donors. Like, what do donors actually want? What's beneficial for them? And if it's beneficial for them, that's going to help get them through the door. For some of them, that might be, childcare at your center, that you can come in and maybe you do get a gift card or a free lunch or something like that. For others, it might just be straight cash payments. For others, it might be the ability to you're giving back to your community, or maybe you do a blood drive with your school or your church, and you could do something together, and that's a benefit, but it's not something that's going straight to you. It might just be going to the larger community. So I do think there's so many different segments of people out there, and there's many different interests they have. And to put it in an economic lens, what's sometimes called price discrimination, you want to reach out to each group and say, how can we best match your interests and your willingness to give with what would be sort of a win-win all around. And so I do think that, there'll be a lot of interesting experiments going forward. I think in tweaking how that could work in different communities, and I just hope the regulators don't step back and try to apply a very simplistic black-white framework of either it's in this category or it's not, and if it's that, it's not okay, and here it's okay. So I hope there's the space to be creative there, because I do think there's a lot of good that can be done when you draw people in based on their actual interest and needs.
Right. So you mentioned your own personal experience with COVID, which was unpleasant, I think, at least, and I believe probably everybody would share that assessment. Do you think that the difficulty that we as a society have had in kind of navigating the complexities of pandemic response and reopening and all of the things that are associated socially and economically with what has been going on, do you see COVID as a complexifying type of factor, or is it just kind of another factor that gets considered along with everything else in what is already a fairly complex environment?
Yeah, no, that's a great question. And, as we're doing some more work right now, both in Europe and the United States, we're immediately having to put like a big line in data in pre-COVID and post-COVID, just because COVID changed so much in people's patterns, in their daily habits, in their medical needs, in their interface with healthcare, and their understanding of health vulnerabilities. So we are, we've been in a period of the last 2 or 3 years of enormous change, both from COVID and then the economic aftermath of COVID. So I do think it's this period right now where the past patterns are all in flux, and a lot of companies, both in the nonprofit side and the for-profit side, are trying to now understand what is the new normal and what's most important to people. I mean, we're in a period now of relatively high inflation. We had a period of gas prices spiking a few months ago, and if you have to drive to a center, all of a sudden gas costs twice as much. Are you going to do that? If you have to put, food costs twice as much to put on your dinner table, does that mean you go more or less? As unemployment, though, is still relatively low, how does that impact things? So yeah, I think there's a lot of change, and really COVID was the breaking point there that shook everything up. And we're still sort of adjusting to what are the new normals. But I think that also creates a sort of an opportunity as well, that you, in periods of flux, you also have an opportunity to kind of develop new norms and kind of set new baselines. And so I think it's an interesting time for companies in this space to sort of, as people's lives are kind of in flux and trying to figure out where they're going to settle down, develop some new patterns that might actually be better and even inconceivable from a few years ago.
One of the things one of the many things that occurred with me in thinking about your answer there, is one of the impacts on plasma centers has been the wellness of donors via COVID, and we have had more than 2 decades of experience in doing donor health studies, and I think that there's a refreshed interest in these questions pertaining to donor health, and as we have a robust standards program, and it's a highly regulated industry. So with all of the work that we have been doing, we've had some pretty major publications coming out in the past few years, and we intend to have more in the very near future with regard to donor health studies. How do you think is a good way of, I guess this is sort of 2 nested questions. One is, your idea of thinking about the ethics and the public policy elements of the donor health question, and then kind of a similar parallel question with regard to the industry's standards and the regulatory framework. You can address those in whichever order that you want.
Yeah, no, definitely. And maybe I'll go in reverse there. So, I live in Washington, D.C., and I have a lot of friends who work at federal agencies. And I have to say, the stories I hear don't always inspire confidence. And it's not because, the bureaucrats are malicious or ill-informed, or, it's not necessarily one of intent, but oftentimes these agencies are overburdened with a lot of responsibility, and there is an information problem. And they often don't have the capacity, the staff, to do good research in service of standards development. So there is, I think, just an enormous need for industry in general to take up a lot of self-regulation, in conversation with federal regulators. But if at the end of the day the federal regulators are the people taking the lead, you could get in a situation where people who don't really know what they're doing are putting frameworks on others that really aren't optimal from sort of public welfare perspective. So that's not a knock at federal regulators, but just the information challenges are so great, particularly in technologically changing industries, where there's new developments, new science. And I do think it's sort of very helpful for the industry to be sponsoring the kind of studies you need to establish a record, to say, look, this is where the concerns are, this is where the concerns aren't. Here's what we can use both to guide our own back practice and behavior. And if regulators do want to put out some hard guardrails, we can make sure that they're doing it in an informed way. So and my sense of the plasma industry and the PPD, I think, has played a really important role in this. being that go-between to say, we're from industry, we know, what the most important questions are and can help sort of navigate those with a strong empirical record. That's really valuable. To get to the sort of the more general question of donor health, I do think this is an area where there's going to be a ton of interesting stuff coming down the pipeline. I spent like an hour last night just reading some of the latest literature on plasma proteins and rejuvenation experiments, ways in which combinations of different proteins looks like they really rejuvenate certain cells. Make people younger and that sort of thing. And this is still its infancy in many ways, but you could imagine, a lot of breakthrough science over the next 5-10 years that really makes the value of this industry go up tremendously. Raises all sorts of new questions about how we're going to collect. I even see some speculation that there might be plasma proteins we could collect from animals and actually use those as well. And so I think there's just going to be a lot of interesting new science coming down the pipeline. And there is a sort of lingering question of what's a health benefit and what's a health risk. As mentioned earlier, there's definitely a portion of the population, those that suffer from hemochromatosis, for whom giving blood is a healthy thing to do. Like it's unambiguously good for them. My sense is, and I'll just put this in a very tentative ways, I think there's some literature out there that suggests that even blood donors more generally, there might be benefits to people to giving blood more generally. We don't necessarily know why, whether it has to do with iron or just plasma protein rejuvenation, that sort of thing. So you could imagine at some point the biohackers out there, potentially having an interest in giving plasma or blood for their own health benefits. If those turn out to be substantiated. There's also a question, of the donors who are maxing out their opportunities to give. If you do that for a year or two, what should they be paying attention to? What sort of maybe vitamins or supplements should they be taking to make sure they're replenishing what they need to? And so I think it's important to do that research, and I think there will be a lot of interest from all sides on that. And it's sort of what's continues to be so exciting about this industry is I think there will be sort of scientific breakthroughs that will continue to shed light on ways in which you can use blood and plasma for human health, and that's gonna create all sorts of interesting new opportunities, and we want to make sure that the risks are sort of calibrated alongside those.
Just barely scratching the surface of the potential, then, in terms of being able to describe what we might do. One of the things that I have considered, and I don't have any data on this, and I'm not sure if any of our companies do, and I'm wondering if you had any, and I know you have firsthand experience donating blood, for example. There's a certain portion of the population in any country, people who are eligible to donate and don't. And there's a fraction of those, whatever proportion of them, do it because, or don't do it, choose not to do it because of a dislike for or even fear of the venipuncture, the needle, the pain involved, things like that. And I was just curious, what is an economist or econometric way of looking at that potential population out there that we could have as donors, but they haven't done it because of either fear or pain or an actual very real concern with what that would mean to have a needle in them.
Yeah, I was just doing a survey recently with one blood company, and one of the questions we're sort of looking at people in a particular area and understanding, who wants to give, why do they want to give, what would it take them to get them through the door, and one question is, have you given it last year? If not, why not? A surprising number of people just say, either I wasn't asked or I didn't know it was a possibility. And I think there's quite a lot of people out there in that camp where they're not necessarily opposed to it, but it's just not on their radar screen. It's not something they've considered, and it's possible, I think, because right now it probably still fairly rare diseases that most of the plasma protein therapeutics are directed towards. I think as you see maybe more sort of mainstream illness and disease that they treat, you might see more kind of common awareness of the value of doing this sort of socially. And that it'll be interesting to see if sort of a wider and wider percentage of the population even perceives that as an opportunity. If I have free 2 hours one weekend, is that something worth doing? There's also, I think there is a group of people that actually are opposed to it for various reasons. It makes them uncomfortable. They don't like needles, that sort of thing. And that's something too. I think sometimes just it's a matter of experience. Like it's some of those are real fears from experience. Some of them are just being afraid of the unknown or not having tried it. I'm trying to think back the first time I gave blood. I think it was something you have a little bit of trepidation about before, having never done it before. Once you do it, oh, that's not such a big deal. I do think too, if people have an experience of a family member who needs blood or needs plasma, that also sort of can wake them up to something like this. I know in some countries where the healthcare systems are less developed, you even have almost sort of networks of blood giving where a family member is going to need blood in 6 months for an operation. The rest of the family might all go donate so they can build up a pool of blood, and that makes it much more real and direct, the impact you're having. And there might be other ways to do that in a more in a larger society to make it apparent the sort of value of these donations. But I think you will see probably a lot of experimentation over the next few years of how to message to different groups, and get them interested. And for some, they're happy to do it as long as they know that donation is going to be valuable for others. For other people, it's gonna make sense for you to offer them something to compensate them for their time, for their effort, for their discomfort. And you can probably do that and still be a very good deal for everyone involved. And so I kind of look forward to the creative development of different ways to reach out to different people.
Yeah, I think it would be a wonderful thing to have a number of new donors all the time coming into the population that would be able to donate plasma for people with rare disease and indeed with all conditions. And we have long encouraged blood donation as well. So as an industry and as a trade association, so it's always been important to us. So I guess one last question for you. What's next for you? You talked a little bit about some of the current things you're working on, but if you can give a little preview of anything that you might be coming up with in the near future.
Yeah, so we're still in the midst of finalizing this massive paper on crowding out, and not only does it do everything I mentioned at the outset, but we have zip code level data, and we can examine whether not only you're seeing crowding out in a catchment area, but down to the level of the zip code that a certain center is located in. We have data on blood discard rates, just to make sure we're not getting worse quality blood being donated when there's competition. We have data also on advertising spend. Make sure we're controlling for that. So there's a huge paper that we're putting together that I hope is going to be a real sort of guide star in the literature. We're excited to get that off our desk here. Definitely doing some more sort of field study type work with blood and plasma centers to understand donor motivations. What gets people through the door? What do different people, different communities need and want? How do you message to them? I think there's also there might be some interesting regulatory questions that continue to come up in countries that have historically either banned or restricted the ability to give plasma for compensation in particular. So I think there continues, particularly in Europe, to be a lot of debate about what those rules are or should be, and so we're going to perhaps do some studies in Europe as well to try to understand both what's happened historically in different contexts and what might be useful policy-wise in terms of advice moving forward. So it's certainly, and I think we're, as mentioned too, we're in a time of change, and I think a lot of people in the industry on all sides are sort of trying to understand how things are changing, and just getting ahead of that as well. There might even be an opportunity to look at some of the economic impact of payments to donors, and the value of that for local communities. So it's a tremendous amount of stuff that we remain very much interested in, and hope to be able to, if I get a few more things on my desk, sort of focus full time this summer on a number of these projects.
Great. Well, we're very much looking forward to seeing what you come up with as well. So, Bill, Dr. English, thank you very much for joining us, and have a good rest of your day. And we'll speak again soon. Thank you.
Thank you, Josh.